consultant surgeon at Mulago National Referral. I do mostly gastrointestinal surgeries and endoscopies and laparoscopy. That is my area of specialization. And yes, a very good topic for today, the gastroesophageal reflux disease, which is something we see quite often. Yeah, and so it will be a very good discussion for us today. Thank you for hosting me tonight.
Wow, thank you so much, consultant surgeon Dr. Gideon. I don't know where to begin because really you've scoped a lot of academic books and you're a giant in the medical sector. We want to thank you for sparing time to come and give us health education. And of course, you know, your expertise is the one that we rely on because 75% of the disease in Uganda, they are preventable. And if this condition is preventable, that means our communities are productive. Let's get deep into that topic. So when you say the gastroesophageal reflux disease, what does it literally mean?
Yeah, so thank you. So gastroesophageal reflux, you are looking at two things. One is gastro, the other one is esophageal and reflux. Gastro meaning stomach, then esophageal, which is the esophagus. The esophagus is what helps us to bring down food from the mouth to the stomach. And then the stomach in the medical world, we call it gastro. And so reflux means to come back. So literally you're coming back from the stomach into the esophagus. So what is coming back is the acid. The stomach has acid, and this acid helps us to break down some foods. You also neutralize some bacteria, and so this acid is coming back from the stomach into the esophagus, and that's what we call gastroesophageal reflux disease. And how does this come about? Maybe that is a question that we can ask ourselves. Naturally, the area between the esophagus and the stomach has a valve. A valve, you can equate it to like a bicycle. When you are pumping air into a bicycle tire or a car tire, you can pump it in, but it doesn't come out unless if you open that small valve. So equally, each one of us has a valve between the esophagus and the stomach. And so this valve is supposed to help you so that when you eat food, it goes into the stomach, but it should not come back up. So for a number of people, this valve will get weak. So this valve can get weak, and different conditions can make it get weak. For some, it can be from the time of birth. They have weakness of muscles around that valve, so as they grow, it just gets weak and weaker. For other people, it can happen spontaneously, like nothing is really there specific to tell you that that this is that the valve has become weak. For others, you have a lot of pressure in the stomach or the abdomen that causes this valve to, you keep pushing on the valve, and it becomes weak. For example, some people who are obese, those ones who have a lot of weight. Others in pregnancy can also induce, because it also you have a lot of fullness of the stomach. Of course, as the pregnancy grows, you can get that reflux here. So those are some of the things that can actually predispose you and weaken the valve. Yes. Then of course others are habits like smoking. Smoking weakens all the body muscles. So as it weakens the body muscles, it can also weaken this valve. Then also things like people who take a lot of caffeine or coffee, and then the carbonated drinks that may increase the gas in the stomach. That also increase production of acid in the stomach that can predispose to reflux of this acid into the esophagus. So those are some of the key causes for this.
So those key causes are the same as the risk factors that could predispose you to getting this condition?
Yeah, it's mixed.
It is mixed. When you talk about smoking, we have seen different people say maybe if they are taking shisha, they are not smoking. Others who use cigarettes. Which type of smoking here that can easily weaken the valves?
No, usually for most of the, whether shisha, whether this smoking that we see, nicotine in the cigarettes or whatever people are smoking weakens the muscle fibers. So as these muscle fibers weaken, so it eventually will lead to formation of this weakening of this valve. And I think, as you rightly said, here commonly people will know it as HKTO in Uganda, HKTO or heartburn. And so what you feel is heat rising up in the what? Heat rising up in the chest. So every time you eat food, you feel a lot of heat in the chest, okay? For now, there are two categories. Sometimes you might eat some food and you randomly get heartburn. It doesn't mean that you have gastroesophageal reflux disease, no. But if you have this and it is persistent, then you qualify, you go to the other side of gastroesophageal reflux disease. So you either get a persistent heartburn, that is one. Then two is because this acid is rising from the chest, going to the from the stomach to the esophagus, from the stomach to the esophagus. Over time, it causes wounds within the esophagus, and so these wounds will easily give you pain when you're swallowing, okay? And this pain when you're swallowing can transform to difficulty in what? Difficulty in swallowing. And then also other people, when they sleep, especially like at night, they feel a bitter sensation in their mouth, which is acid, that acid sensation in their mouth, a bitter sensation on their mouth. Other people will get recurrent throat infections in the night. So every time you wake up, you have throat infections, you have a hoarse voice, and it is something that you have not been having before, but you see it coming as a more frequent problem because the acid is rising to the stomach and burning, like causing burns and wounds around the palate, around the throat. So you start to get recurrent infections of the throat. Some people might take it as asthma, especially now you develop asthma
because of breathing issues,
because this acid will keep irritating the throat as well. And then for other people, they will tend to get what? They will tend to start to have still like that metallic taste, like feeling of a metallic taste in their mouth, which is a little more frequent. Yeah. So, and then like a cough in the morning. So those are some of the symptoms and signs that someone can come to you with, or someone can present with.
Wow, thank you so much, doctor. There are some common remedies that people tell you that when they eat them, the problem actually reduces for some time, then later it comes back. We've seen people with heartburn tell us they can use soda ash. Some use sugar, some use milk or yogurt to relieve that heartburn, that burning sensation. What could be the best advice just in case a person gets that? Before we go to your relevant experience, because we wanted to know, maybe in a week, how many people do you see who present with heartburn issues?
When you look at the clinic which you run, probably 4 to 5 people out of 10 will have issues to do with heartburn. That's about almost 50% of the consultations. And so that is quite significant.
It's a very big number.
That is a very big number. Yeah, so it is it is something that is of course that is a bit common. And so with that in mind, of course, the other question is, yes, you have this heartburn, and then you need to do a consultation. Of course, if you've been getting heartburn, you need to do a consultation with one of your doctors. That is something that will definitely help you.
Yeah. So now we've seen that now 50% of the population in Uganda here is suffering from heartburn. Would you want to rate this heartburn to the high consumption of the street junk and the fast foods compared to the, because I feel maybe in the rural communities maybe heartburn may not be too much significant, because I believe, or we believe, that they eat more of whole meals or whole food when you compare it to the most city dwellers.
Certainly that is right. And I think from the bit of the introduction we gave, obesity is one of the key contributors for this heartburn. So obesity, and then the other thing that comes up quite commonly is called the hiatus hernia, because of the high pressure, too much pressure in the abdomen. Now, obesity, how is this obesity coming about? It's the junk food that you are talking about. And so these are conditions we are seeing more in the Western world, but now they are coming into the into our community,
Uganda,
into
yeah.
Uganda and East Africa and Africa.
Because we are trying to catch up
Because that
the
is
urbanization.
that is the urbanization. Yeah. So the junk foods, of course, one, they are very high in oils. And then secondly is that, yes, they trigger, of course, acid formation. Some of them have a lot of pepper, they trigger acid formation. But also thirdly, most of these junk foods are the ones that have very high calories, and so eventually we end up with obesity. Yes, so that is one that is quite true.
Wow. Thank you so much, Dr. Gideon. For our viewers, we want to still encourage you to visit our social media platforms, our YouTube, Facebook, Twitter, LinkedIn, Google Data Vision Uganda, so that you can have your question or your input shared there, and of course we shall get back to you. But don't forget that you can also use the telephone numbers have been displayed on your TV or screen where you're watching from, and we can get back to you anytime, because here we believe in you, the viewers, than us here. So we want to thank you. As we go for a short quick break, we want to encourage you to walk around, and of course you do simple exercises that are very important to reduce the risk of the non-communicable diseases. See you shortly. How many minutes?
Good Day TV, transforming your life.
Life is a race, not against others, but for a purpose greater than yourself. Every step you take matters. Every decision you make can change the course of someone else's journey. At Makere Full Gospel Church, we are running a race too. A race to purchase land next to the church compound so as to expand our parking space and build more infrastructure for God's work. With your purchase of Run Your Race book, authored by our very own Pastor Fred Wantanti, for just 30,000 Ugandan shillings, you're not just buying a book, you're joining the race. All proceeds from the book sale will go toward purchasing the land. Together, we can build a legacy that will last for generations. Buy your copy today and let's run the race together.
Are you a resident of Wakiso, Nansana, Senge, Namusera, Kampala, and other neighboring areas looking for a school with a modern, comprehensive learning environment, qualified and caring teaching staff with a trustworthy support team? Look no further. Take Time Kindergarten and Take Time Junior Schools develop your child's learning capabilities to greater heights in a God-fearing setting. We nurture leadership, responsible citizenry, academic and co-curricular excellence like sport, swimming, and other activities. We offer pick and drop services for our learners in our clean fleet of shuttles. We also have both day and boarding options. Registration is in progress from kindergarten to P7. Contact us via phone or WhatsApp on 0784 448833 or 0743 448833. Find us at Naluvule Senge along Kayunga Kawanda Road. Take time, lead to excel, and excel to leads.
Good Day TV, transforming your life.
Once again, I want to welcome you to our health and beauty program. We've been talking about the Gastro Esophageal Reflux disease, which we normally know or call the heartburn. So far, we've talked about the definition or what it is. We've looked into the signs and symptoms, and also we've looked into the risk factors and how actually we've explored how obesity is one of the biggest risk factors, and the junk food, the spiced, the oil, the street that you like may predispose you to obesity. In the long term, you have a risk of getting the heartburn or the gastroesophageal reflux disease. I am still having Dr. Gideon Krigamba, a very known specialist for the gastrointestinal. Yes, he's still here with us, and he's going now to take us through the other parts of this important discussion. Doctor, you're most welcome from a quick break.
Yeah, thank you very much. Yes, we discussed a bit on how we have this presenting. And,
yes, please.
Which is something very key. Of course, the question is, yes, if I feel these signs, if I
Where
feel
do I
these
go?
symptoms, then what? What do I do? I think the first step is to go to a health care provider. And a health care provider, definitely I would say that you visit a gastrointestinal health specialist if you can.
Isn't that very far? Because
I'm saying if you can, but of course, for when you look at the biggest majority of our population, at least visit a doctor. We have most doctors, at least in most of the health centers, in most of the clinics. We are happy that government is increasing the output of doctors. So at least we have so many of these.
Yeah, very many.
Yeah. So which gives us a big advantage. Yeah. And these are medically trained doctors. Is not just any doctor, medically trained healthcare workers. Yeah. And so usually once you reach when you get to the medical doctors, usually what you want first to establish is, of course you'll be weighed. They will weigh you. They take your body mass index, which is BMI, to try and see, are you within normal weight, are you overweight, are you obese,
1, 2, or 3,
1, 2, or 3, or are you extremely obese?
They're ungraded.
Then from there, then we see, okay, now how much has this acid been refluxing? Of course, that is from the history that you give. And then from that, we decide and say, okay, now how much damage has this acid caused?
How do you determine the damage?
Yes, how do you determine the damage? One is that for you to determine the damage, you need to see. And for you to see, there is a special procedure we do, which is called an endoscopy. Endoscopy for the stomach. So the endoscopy looks at the esophagus, looks at the stomach, and looks at the first part of the small intestines. Yeah, so this endoscopy helps us to see. You're able to tell, one, the extent of the damage. Two, you're able to tell if there is any other effect within the stomach or esophagus, because it can burn the esophagus, okay? It can cause wounds there, but also for some people, it can start to cause transformation into early cancerous stages that can also lead to that. So you want to have a look at all that, look at the throat, and then once we have looked at all that, there are some other tests which are a little more specialized, but those ones we recommend based on what we find, what we find, the manometry, for those who might not know, but at least an upper gastrointestinal endoscopy is the most basic test that we would want to do if you have persistent heartburn. Yes, or reflux. So that is something that we usually will carry out. Yes. And then some other tests for some people we recommend they do, we call it a barium swallow, where they do some x-rays for your chest, and so these x-rays will help to see if you have a hernia, if you have this, so you can tell if there's a hernia. Even on endoscopy, you can tell if this place has widened, if the acid is actually coming back into the esophagus. You can see it at the barium or the endoscopy. You're able to tell all those things from those tests, and that now helps us to decide, okay, now for you, we are going to manage you like this. For you, we shall manage you like this, depending on the findings.
Wow. Now, isn't this more of a high-level healthcare facility? Because those GI endoscopies, I hear them, they're only in higher-level facilities. Now, for a person in Health Center 3, how can they easily diagnose the heartburn?
I think we said one from the symptoms that someone has, the presentation of the symptoms. If someone has had this as a persistent problem, then rather than sticking with them in a health center,
patients,
yes, refer them to the next healthcare level, so that they can at least be able to access an endoscopy.
Okay, that's perfect. Now, Doctor, based on the diagnostic findings, you said they will tell the different treatment interventions that will be given, right? So now, what could be the management protocol? You want to begin with management? Yes, before treatment.
So I think management, of course, when we talk about management, it has many arms in it.
Yes.
So the many arms, I think the first best arm that we look at in management is lifestyle adjustment or modification. That is the first step. Lifestyle modification, one is cut weight. If you're overweight, cut weight.
Begin immediately.
Yeah, begin immediately and cut weight, okay? Because obesity is the biggest problem, as we said. So lose weight. And then two, after losing weight, now we focus on your diet. Of course, even diet will help you to lose weight. And losing weight involves regular exercises, okay? And these regular exercises, at least averagely, we say, make at least 6,000 steps, 4 kilometers per day. Yes, those are equivalent to 6,000 steps.
Isn't that too intense?
You don't have to walk from here to Kampala Road, but even where you are working, 6,000 steps per day.
That means I make them unknowingly because I walk.
Yes, so 6,000 steps per day are a very good exercise for you, and that should be intentional. Then two is look at your food, the food you eat. Okay, one, don't eat and sleep on a full stomach.
3 hours before bedtime.
Yes, so when you eat, yes, exactly, sleep at least 3 hours after eating. So last meal 3 hours before bedtime. So bedtime is at 11, eat at least at 8, okay?
Yes.
Okay, yes.
I'm looking at practicability and I'm imagining here, I often use this example. My very first time to come to Kampala, I went to sleep in Nambole. So this person came to pick me from the bus. It was around 8 p.m. So we used a taxi. 8 p.m. we reached there at 11. And they cooked, so me had slept. So they woke me up to eat. So I could not eat because I was not used to eat beyond what? 8 p.m. So I realized that in Kampala it is almost a daily schedule. People eat above 10 p.m. Most Kampala people home. So when you are speaking it, I was just reflecting on practicability. How best can they achieve this?
No, but you see now, if you have the problem, then you find a way of solving it.
So I thought we would generate the public, ensuring that we do not wait for the people who have it only, but also at the household level. What time should they actually stop eating?
Of course, what is ideally desirable is 3 hours before bedtime. That is the desirable time for your last meal. And of course, for many reasons, not just reflux, but also it is a long period of inactivity when you have this food just seated, not doing much, and so that is one of the key contributors for obesity. Yes, so that's why it is advisable to at least eat 3 hours before bedtime. And of course, too, is when you eat, try and take light meals for dinner. Okay, vegetables, warm water, okay, things that are not going to sit in the stomach, not cassava, millet, okay, for dinner. Are things which are going to sit in the stomach, okay, and they take about 4 or 5 hours, because the idea is that by the time you go to sleep, most of the stomach should be empty. That is the goal behind, because the stomach starts emptying usually about 1 hour after eating. So by the end of 3 hours, you have emptied most of the stomach contents. That is the idea behind. Yes, then we have talked about foods that increase acid, okay. These foods that are rich in pepper, okay. For some people it will be pineapples, for some people it will be ginger, okay. For some people it is really melon. Those are foods that will trigger a lot of acid formation, because that acid will easily reflux into the esophagus. Then 3, we talked about the carbonated drinks, okay, sodas, these ones that increase a lot of gas. And then caffeine, okay, coffee consumption is one of
the energy drinks.
Yes, energy drinks. And then coffee, a lot of coffee, that is also something that causes reflux, so that is something you have to cut back on significantly, okay, in terms of feeding, because that is very key. And so once you have dealt with that, you have lost the weight, okay, you have tried to work on weight and exercise, implemented this, then for most of the people, they are able to improve.
So does that restore the weakened valve that was there in the first place? If a person lost weight, in the pathophysiology we looked into how the valve is weakened. So will the valve be restored, will the strength come back, or it will work but not its full potential, just like before it was?
Restoration of the valve may not be possible, but you don't have more pressure on the valve. Okay. So you're not making the problem worse. And also the other beauty is that because the pressure from the obesity on the abdomen or stomach is less, then you are able to reduce the amount of acid that is going back into the esophagus, and so that makes it very, very helpful.
Wow. Thank you so much. Oh, of course, I want to thank you, Dr. Gideon Kuigamba. Thank you for being so much resourceful. Now, we've talked about management. We've only looked into lifestyle modification first. It is the management protocol that we have, or you want to?
No, that is, I told you, that is the baseline.
The baseline.
Yes, so alongside that, we give sometimes we give some medicines. So these medicines, one, they target to reduce the amount of acid in the stomach. Then 2, they also target to increase the emptying of the stomach.
After
That when so that we have eaten, acid is formed, it is taken out from the stomach, so you reduce the amount of acid that is coming up to the esophagus. Yeah. Now, once you have instituted that, okay, and of course that's why I would want to talk about, maybe like you said, about milk. Okay, someone who has heartburn, someone who has reflux, is milk helpful or not?
I wanted to ask you about those.
Yes, so those are
even
some
soda
of the,
ash.
those are some of the things that people ask. Okay,
even sugar. Are they helpful?
So see, if you already have so much acid and you take milk is good before you have a lot of acid and the heartburn. But once it has already set in and you take, for most of the time, the milk will coat the surface, so it will cover the acid under. So even acid has more contact with the stomach.
You feel that
so you might trigger more of what we call gastritis than relief. But if you're taking your milk not as a treatment modality, then it is fine, because by the time the acid is produced, then it has what to digest as well.
Okay.
Yes. And so that is that. And then for most of the people, they will improve on these treatment modalities.
Okay.
So they will improve on what we have discussed, and that is about maybe 70% now. The other fraction that fails to improve on this, then might now be the candidates for surgery. Okay. Something popularly we call fundoplication. It is quite a bit of it's a mouthful of a word, but in brief,
I don't want to speak.
You're trying to restore, you're trying to create a new valve so that acid does not come back to the esophagus. That is in simple words. Okay.
Okay.
So that is something that can be considered.
Okay. So this surgery, it is available here in Uganda.
Yes, it is available in Uganda, and even much more interestingly, we do it now gold standard using the pinhole or the laparoscopic surgery, and that is the gold standard now for this surgery. If someone needs it, we no longer have to open up someone, but we do it via pinhole.
Wow.
Yes,
so if for example, in the last maybe quarter, how many surgeries have you done? Maybe have you done as a department for this very important condition?
Yeah, for this condition, averagely in a week we'll have about maybe 4 to 5 patients with this, and we do laparoscopic surgeries for them successfully.
4 to 5 in a week. So that means in a quarter it is over a good number.
It's a good number.
Wow. Thank you so much for restoring lives, Doctor. But of course, very important, we looked into the management. The management, dear viewers, it's the only way how you can actually benefit from Good Good Day Television. Just you know that the prevention is better than cure. And 75% of the health conditions that we have here in Uganda, according to the Uganda Demographic Health Survey 2022, it says that they are preventable. That means that prevention starts with you. And just like we've talked about the Gastro Esophageal Reflux disease, the prevention modalities are the ones that you have. When it comes to surgery, they may become more complicated, and cost implications may be too much for you as an individual and at your household. Yes, so let's dwell more on prevention and learn how best to manage these conditions at our household level, so that we can remain productive to our families and our community. Now, Doctor, would you want to take us through some of the treatment strategies that are available, or we've looked into them already?
Maybe a bit of prevention.
Please.
A bit of prevention, and one is the prevention is one, as we said, weight loss. If you haven't gained the weight, don't gain it.
And you know, obesity has increased on the last 5 years. We have, and women are the ones leading. I love the statistics that you can't move from 16 to 26% and you think you are safe. That means we are going to be increasing in the next 5 years. So when you talk about weight, viewers, and what is hurting these days that when a person gains more weight, and even if they came for consultation and talked about their weight, they don't feel good. Sometimes they say body shaming, mental health, whatsoever. But we are speaking the truth. You emphasize on weight loss so that people don't take it to be mental breakdown, because weight has become a problem.
Yeah. So as much as you can, yes, weight loss. And when we say weight loss, of course there is the BMI. You can now, this is something you can find anywhere, so that you know what normal BMI is. And so the normal BMI, you try, when if you're above that, drop so that you go into the normal BMI. Yeah. And so that is if you're overweight. If you have not gained weight, don't strive to gain the weight, okay? Yeah, because that is really detrimental, and it is one of the key causes, okay? If you're smoking, cut down on what? Smoking, or do have cessation of smoking, okay? If you not been exercising, we have agreed at least 6,000 steps per day is something that you should do. If you love a lot of caffeine, if you love a lot of the carbonated drinks, the energy drinks, cut down on these, because this is what is going to trigger the gastroesophageal reflux. We have talked about the timing for food, okay?
Yeah, meal
as
timing.
much as you can, meal timing. Try and have meals at least 3 hours before bedtime, okay? And try and have light meals for dinner. Don't eat posho, karo, cassava for dinner, then you sleep 30 minutes later. Yeah, so those are some of the things that are going to help us a lot, yes. And also we are of course trying to have a lot like sort of sensitization of people on television stations, just like here through our society. We have a society that we call a Society of Uganda Gastrointestinal and Endoscopic Surgeons.
I haven't attended that. I've seen one for surgeons specifically. So you people, you belong to surgeons, again you rush to...
So it's like a mother body. So we have Association of Surgeons of Uganda. And so this is like, that's the mother body. Then under that we have a smaller society.
Branches.
So now through this we are trying to do sensitization of people about one, how to do prevention for such diseases, but also the treatments which are available.
We are not aware.
So that we are not left in the dark. Okay, yes, we are not left in the dark, because that is our key responsibility.
Thank you so much, Doctor. There is somewhere I want to take you back for a minute, where I talked about that if gastroesophageal reflux disease is not paid attention to, it can be one of the risk factors to getting cancer. Would you want to give some highlight about which type of cancer? And
I think okay, thank you for that. Just as we said that gastroesophageal reflux is acid coming from the stomach into the esophagus. Now, by design, God designed the stomach that the stomach is able to withstand acid. And so this withstanding acid, the coating or the inner lining of the stomach is designed to make sure that it's safe for acid to be there 24 hours. We are producing acid 24 hours. We are producing acid now. This acid, when it is moving the small intestines, there is some solution that is produced by another organ that helps to neutralize it, so that it is safe to go into the small intestines, from the stomach into the small intestines. Now, when this acid comes back into the esophagus, that other solution has not been produced yet, because it is ahead. So meaning it is returning as it should be. Now, the lining of the esophagus is designed by God not to withstand acid. Acid should not be coming to the esophagus. So because of that, That's why it damages the lining of the stomach.
Of the stomach.
And so as it damages this lining over time, sort of the esophagus, not stomach, as it damages the lining of the esophagus over time, the texture of the esophagus changes from normal to abnormal. And so that causes esophageal cancer.
Wow.
Yes.
I followed the physiology very well. My goodness, just to know. The GI physiology is one of the most tricky. It's the stomach, the esophagus, the what. Koja, I think we shall share the pictures so that the viewers will be able to learn more about this very important condition. To look at the esophagus, the stomach, the mouth, and the whatsoever, so that they can fully know this gastroesophageal reflux disease in terms of pictures and how it can come about. So now, doctor, what is your call to the public, the community? I want you to call upon the community. But before we go to that, can this condition, in which age categories is it most common? Can it be in the young growing children, then the adolescents, the young people like me? I categorize myself as a young person actually. I don't know if my age group can also present with it, or it is commonly in people who are elderly.
No, it is common in all ages, but the biggest age is usually middle-aged people, because that's the point when most people have earned some money, they are starting to put on weight, but also it's the age group where people are eating a lot of junk. But now we are seeing it more also coming in the young children because of obesity. In the young children, childhood obesity. For some children, it can come even as early as 1 year or 2 years because of some abnormalities that come during the formation, but that is a very small fraction,
percentage.
A small percentage.
Okay.
And of course, as for some, as you grow old, your muscles just become weak, and so you can develop the condition. But the biggest concentration is the middle-aged people.
Perfect.
Yes.
Thank you so much. Now, just like you said, you have an association for gastrointestinal surgeons. You would want to scale up this important health education awareness across the country, throughout, in different formats. Now, what's your call to the public, and also the call to the government in bid to support your awareness campaigns, but also increase more awareness about such gastrointestinal health conditions, since they are caused by mouth, by us eating? I think awareness can prevent more.
Yeah, thank you very much. One is, of course, the public. I think, as we have said, the biggest challenge is the biggest challenge that we have is obesity. So let's look at what we eat. What we eat will make us how we look and who we are, and affects our health directly. So what we eat, and what we eat. I think that is something that we really need to focus on. What we eat, when we eat it, at what time we eat it, okay, is something that we need to look at as a public, okay. Now, of course, as the government, yes, sensitization is very important here. And this sensitization is, of course, in terms of could be on radios. This is already a very good opportunity for people to learn. But I think the government, the mandate is to ensure that we increase the avail gastrointestinal health specialist. That is one. Because that is it is a fundamental. Each one of us eats every day.
Yes.
So we definitely would need health GI. So have more gastrointestinal specialists on board.
At least per regional referral
regional
hospitals?
referral
Oh, we already
hospital
have. I'm not aware.
No, there are not so many, but
Okay.
at least have uptake of these. And then we increase more of the training. Okay, training for this. We avail opportunities for training. That's the government, but also funding gastrointestinal health. Okay, For example, we talked about an endoscopy. Yeah, if we need to have these endoscopies in all regions so that they are easy to access. Anyone can access this service. It's not to be a difficult service to access. Yeah, so avail endoscopy services, avail the manpower to do this, okay? And then also the medications when it's necessary to be able to help treat these conditions.
Wow. Wow, thank you so much, our consultant GI surgeon, for sharing this important information with us here on Google Day Television. Now, what is your last remark about this very important topic of our discussion?
Thank you very much. I think my last remark on gastroesophageal reflux is that it is common, and the key thing that most people will get is heartburn, and this heartburn
Good Day TV, transforming your life.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
It's the stomach, the esophagus, the what. Koja, I think we shall share the pictures so that the viewers will be able to learn more about this very important condition. To look at the esophagus, the stomach, the mouth, and the whatsoever, so that they can fully know this gastroesophageal reflux disease in terms of pictures and how it can come about. So, now, doctor, what is your call to the public, the community? I want you to call upon the community. But before we go to that, can this condition, in which age categories is it most common? Can it be in the young growing children, then the adolescents, the young people like me? I categorize myself as a young person actually. I don't know if my age group can also present with it, or it is commonly in people who are elderly.
No, it is common in all ages, but the biggest age is usually middle-aged people, because that's the point when most people have earned some money, they are starting to put on weight, but also it's the age group where people are eating a lot of junk, but now we are seeing it more also coming in the young children because of obesity. In the young children, childhood obesity. For some children, it can come even as early as 1 year or 2 years because of some abnormalities that come during the formation. But that is a very small fraction, a small percentage. Okay. And of course, as for some, as you grow old, your muscles just become weak, and so you can develop the condition. But the biggest concentration is the middle-aged people.
Perfect.
Yes.
Thank you so much. Now, just like you said, you have an association for gastrointestinal surgeons. You would want to scale up this important health education awareness across the country, throughout, in different formats. Now, what's your call to the public the public and also the call to the government in bid to support the awareness campaigns, but also increase more awareness about such gastrointestinal health conditions. Since they are caused by mouth, by us eating, I think awareness can prevent more.
Yeah, thank you very much. One is, of course, the public. I think, as we have said, the biggest challenge is the biggest challenge that we have is obesity. So let's look at what we eat. What we eat will make us how we look and who we are, and affects our health directly. So what we eat, and what we eat. I think that is something that we really need to focus on. What we eat, when we eat it, at what time we eat it, okay, is something that we need to look at as a public, okay. Now, of course, as the government, yes, sensitization is very important here, and this sensitization is, of course, in terms of could be on radios. This is already a very good opportunity for people to learn, but I think the government, the mandate is to ensure that we increase the avail gastrointestinal health specialist. That is one. Because that is it is also a fundamental. Each one of us eats every day.
Yes.
So we definitely would need health GI. So have more gastrointestinal specialists on board.
At least per regional referral hospitals.
Oh,
we already have. I'm not aware.
No, there are not so many, but at least have uptake of these. And then we increase more of the training. Okay, training for this. We avail opportunities for training. That's the government, but also funding gastrointestinal health. Okay, for example, we talked about an endoscopy. Yeah, if we need to have these endoscopies in all regions so that they are easy to access. Anyone can access this service. It's not to be a difficult service to access. Yeah, so avail endoscopy services, avail the manpower to do this, okay? And then also the medications when it's necessary to be able to help treat these conditions.
Wow. Wow, thank you so much, our consultant GI surgeon, for sharing this important information with us here on Google Day Television. Now, what is your last remark about this very important topic of our discussion?
Thank you very much. I think my last remark on gastroesophageal reflux is that it is common, and the key thing that most people will get is heartburn, and this heartburn, when you have this persistent heartburn, then know that there is an issue, there is a problem that needs to be addressed. If you have persistent heartburn, ensure to at least seek health care advice, okay, from a professional health worker, and then depending on how you are, what you present with, they will see how to step up your care from one level to another level. And for most of these, they are treatable. So we should not wait until when we reach the last stages where things have become unmanageable, and then that's why we want to seek health care. Thank you very much.
Perfect. Thank you so much, Dr. Gideon Kurigamba. Before I cut you short, do you have any regards? And for viewers who have private questions and would want to consult you physically, would you want to share your number?
Yeah, my number 0775 581231. You'll see to be displayed on the screen. And my special regards to my family, because who allowed me to be here and spend time with you on the TV. My children, Divine, Aaron, and Hannah. Yes, and my wife, Dr. Irene. Thank you.
Thank you so much, Dr. Gideon. I want to thank you for being on Google Data Vision. And of course, we want us viewers to keep on the comments coming through on our social media platforms. But very important to notice that this program airs every single Wednesday to 9 p.m. and repeated every single Tuesday through to 4 p.m. with me, Kamara Daniel. I intend to always see you all the time and inspire you to prevent yourselves from getting diseases. See you next Wednesday.
Good Day TV, transforming your life. Tosubwa Good Day TV.
Abagalwa abalungi erinnya lya Mukama waffe Yesu Kristo lyebazibwe nnyo. Mbalamusizaako amannya gange nze Kasozi Robert Cephas. Mbanjulira programu ennungi mwogenda okuyita okusisinkana Kristo, okwate ku bisuubizo, osumululwe, owangule, eyitibwa You Can Be Delivered. Ngekutusibwako obuweereza obwa Raising David's Tabernacle Ministries wano ku Good Day TV. Buli lwa Sande okutandika essaawa 5 ez'ekiro, n'olwokusatu okutandika essaawa 3 ez'akawungeezi tugendanga kubeera wamu. Oludde mu bulwadde, olinayo ebintu byonna ebikutawaanya wadde nga walokoka, olinayo ebintu ebyo nga obisabidde naye nga bigaanyi, oba nsonga ya birooto, ng'ebirooto bikufuukidde ebirooto tobitegeera, ogezezzaako eno n'eno. Programu eno egenda kubeeramu essuubi, ekyokuddamu, okuwangula, okubotola.